Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. On this week's episode, we're going to be chatting about Botox. So unless you've been under a rock, you have heard of Botox. I mean, I'm sure people even in the Sahara, people in Africa, Zimbabwe, I'm sure everyone in the world has heard of Botox because it's ubiquitous now. I think we've probably injected over 1 trillion people. However, most people are familiar with the basics of Botox. That is, the purpose of Botox being that you inject a neuromodulator, meaning a drug, in this instance, botulinum toxin A, and as a result, it paralyzes muscles, and as a result of that muscle paralysis, it has an effect. In the cosmetic world, we pretty much use it in 3 regards. We use it between the eyebrows, in the forehead, and around the eyes for the crow's feet. That's pretty much the bulk of what Botox is used for, and as a result, it does an incredible job. It's highly efficacious. If done correctly, can make significant cosmetic improvements, and it's a really, really awesome advance in the cosmetic world. But Botox, like any other procedure and or drug, has many applications, and this is no different. And there are handful, actually quite many, number of other locations that one can inject Botox with varying degrees of success. Now, I'm going to take you through a little journey of some of the more common, uncommon areas that we inject Botox. I'll give you my thoughts as to whether or not I think they work well or not work well. Obviously, the tried and true trio between the eyebrows, forehead, and your crow's feet are always going to be your best bet in terms of effect, cost effectiveness, money, etc. So let's dive in. So the first and probably the most common area that I think that people are doing that are sort of out on the fringe is masseter injection. So first of all, know that the whole purpose of Botox is to inject into a muscle. You are paralyzing a muscle, and as a result of paralyzing that muscle, getting an effect. So as you are well aware, the face has tons of muscles. So the masseter injection is, as it states, injecting botulinum toxin A, Botox, into each, there are 2 masseters, and those are your main muscles for chewing. If you put your hand on the corner of your jaw, that is at the angle of your jaw, bite down as hard as you can, you're going to feel a bulge, and that bulge is the masseter muscle. Now, why on earth would you ever want to inject this muscle? Well, there's a bunch of reasons. Number one, some individuals, either because they were born that way, or because they grind the shit out of their teeth at night, or because they chew a ton of gum, their masseters become really large and bulky. That leads to having a really squared off, wide jaw, which for some individuals looks amazing, and for other individuals doesn't, and they look masculine. So when you inject the masseter for cosmetic reasons, it's because you're trying to slim down the face and make the muscles shrink a little bit, not so large, and make the angle of the jaw a little softer and more heart-shaped rather than square. This is super common in Asian culture because, to begin with, they have very, very strong jaw bones, and so on top of it, the muscle makes it accentuated. So that's the main cosmetic reason. Having said that, there are a lot of medicinal reasons, medical reasons why you inject the masseters. Number one is you have a TMJ. TMJ is the joint in your jaw that you open and close your mouth, temporomandibular joint, can become inflamed, tender, painful, restricted. And for anyone who suffers from TMJ, they know exactly what I'm talking about. And many times it's due to some type of jaw clenching, particularly at night. So injecting the masseters softens the muscle, which then prevents you from grinding as much. That then leads to the next thing, which is some people break their teeth. They break through mouth guards. They grind all through the night due to stress or the way they alleviate their energy. And so Botox makes a significant difference in that grinding effect that people are having. And then lastly, it also impacts migraines because individuals who grind and have TMJ often develop headaches. So it is one of the trigger points that people use for migraines. So masseters in general is a big, big area. The only issue when you inject masseters is that you have to be very careful in how you inject and how much you inject, because unlike the muscles that are between your eyebrows that don't really do anything, the masseter has a major, major purpose. It's chewing. And if you over-inject, you will find that your chewing's a little weak. You will not like that. And if you inject in the wrong plane, it creates a weird appearance. So you definitely need to know what you're doing. So that takes care of masseters. Let's shift. Now, lips. When it comes to lips, most people think predominantly filler. If you want to change the lip, you inject with volume. And to be honest with you, that is probably your greatest tool. Having said that, there are two ways in which you can affect the lip using Botox. Now, I will tell you that I don't think it's super effective. And if you do it, you dabble in it. And if you don't like it, I don't think you should do it anymore. One of them is to affect the gummy smile. What is the gummy smile? Some people, when they smile so tight and so their upper lip gets so high that you're not looking at their upper teeth, but rather at their gums. And it's not a desirable aesthetic look, and it bothers them, and they're conscientious. And so what you do is you inject some Botox in the upper lip muscle, the orbicularis, and because it paralyzes that muscle to some degree, they're unable to smile as much, and as a result, the gummy smile isn't as significant. So, like all things Botox related, it has to do with the amount and degree of injection. That's the gummy smile. Now, there's this thing called a lip flip. I don't really do the lip flip. It's, again, basically injecting Botox into the corners of the mouth and along the edge, trying to relax the orbicularis, again, the muscle around the lips, and as a result, allowing the lip to open up. Now, again, you do it, you like it, awesome. If you do it and you don't like it, well, now you understand. It is an option. I don't find it to be all that effective. Another area that you can do that I do think is effective, but is a little costly, are neck bands. What are neck bands? So they're actually called platysmal bands. And as we age, and it's usually right around our 40s, if you look at someone, not excess skin, I'm not talking about skin, I'm talking about the muscles of the neck in some people, when they talk or when they're standing in static, seem to be tight and they create like a bow, a long band. Now, if it's skin, you need a neck lift. But if it's muscle and you inject that muscle with Botox, it will soften and it will obliterate or soften or make that band less noticeable. It's really big in singers. Celebrities do it all the time prior to needing themselves a neck lift. And I think it's very effective. However, if you compare the muscle between your eyes and one neck band, you'll see that the amount of muscle in your neck compared to that between your eyebrows is significantly more. So you'll have to inject a decent amount for it to be effective, but it does, and indeed it does work. And I think it is something that should be considered if you're starting to develop bands and they bother you when you're speaking or singing, etc. Another one which I think people find interesting, because I think most people are unaware of this, is chin cobblestoning. What the hell is that? Also, another way of saying it is orange peeling. So certain individuals, when they speak or when they are at neutral, they push their lips, unbeknownst to them, together very hard. And the muscle of your chin, it's called the mentalis, you can practice this in front of a mirror, starts to quiver and creates these little dimples at the base of your chin. Now, it's something other people see, not you see, because you usually only see it when you're speaking. And so obviously you're generally not speaking in a mirror. And when you inject Botox to the mentalis, you relax that and reduce the cobblestoning, that is that irregular dimpling. And I think it's a nice effect, and I think it smoothens the area out nicely. And it's not a lot of Botox, so if you do have it, I think it's actually a pretty decent option. All right, so there's 4 really cool things that we can do with Botox. We're going to take a quick break. We'll come back, and I'll give you 4 more. 4 more cool things we do with Botox that you may not been aware of. So let's take a quick break, and we'll be right back with Plastic Surgery Uncensored. All right, welcome to the second half of Plastic Surgery Uncensored. We're talking all things Botox. We're talking all things Botox and beyond. We're talking about the types of uses of Botox that are perhaps not as commonly known or as customary. Now, one of my favorites is underarm Botox injections for what's called hyperhidrosis or over functioning of your sweat glands, aka just sweating too much. Why I love this one is because I have been doing it for years. So what is this all about? Individuals, based on their hormones or their biology, some people sweat more than others under their arms, depending on their situation. Now, if you wear a business suit or you wear a beautiful dress and you sweat through it, you will ruin that outfit. Not to mention, you'll be very embarrassed. So for the most part, for civilization now, we've relied on antiperspirants, and they tend to be predominantly aluminum-based products that, if you will, for lack of better words, short circuit your sweat glands. And so they shut off your sweat glands, and there's a lot of controversy as to how much aluminum you absorb and whether that's okay or if it's toxic. For the most part, I stopped using aluminum-based antiperspirants many, many years ago. Deodorant is its own thing, but we're talking about antiperspirants. And what Botox does is when you inject under the armpits, and it's its own procedure, when the Botox kicks in, you actually stop, that is correct, stop sweating under your armpits for like 7-8 months. And for an individual who sweats a lot under their armpits, they will tell you that is a life-changing, life-altering experience. I'm not talking about a little sweat here and there on a hot day. I'm talking about you're giving a, presentation in front of people, or you're at a party and you want to take your jacket off and everything is ruined. So the way it works is that the Botox affects the nervous system that leads to sweating. Now, the first thing people say is that healthy? And why would you want to stop sweating? There is 2 types of sweating that a body does. There's hormonal sweating, which is predominantly in the armpits and in the groin, which is actually, I think it has something to do with teleologic, pheromones, smells, you know how dogs smell each other, etc. It's the odor creating sweating. And then there is what's called thermoregulation, which is I just sweat all over my body. I got into a sauna, I played basketball, it's a hot-ass day. That thermal regulation, which is it allows me to cool off, has nothing to do with what we're talking about. This is purely the gland-driven sweating under the arm. And listen, I've been doing it for years. I think it's the greatest thing that ever happened to me. So at any rate, it's good to know that it exists, and it's a awesome, awesome procedure. Now, what else can we do? So noses, there's some areas on the nose that we can inject. Now, they do some really crazy things like trying to make the tip of the nose come up and all that. I think that's all nonsense. There are 2 areas in the nose where I think it helps. I don't know that it does a tremendous amount, but it helps. One is with the bunny lines, and one is with nostril or alar flaring. The bunny lines are when you smile really aggressively and they're on the bridge of your nose, those horizontal lines that run towards the inner eye. And the alar or nostril flaring is certain individuals, when they speak, their nostrils flare. There's a muscle there. And we can inject Botox into both those sets of muscles. In this particular instance, I've actually never seen it fully go away, but I have seen it soften. And again, because there's very little downside to it, it's something that you might consider trying and seeing if it benefits you. But it's definitely a nuanced space injection in the nose. Next, we have something called smoker's lines. So many patients will come in, and one of the biggest complaints they have is, I don't even smoke. And I got all these lines up and down my lip. And that smoker's lines is one of the hardest things we have in plastic surgery to correct. There really isn't a good solution. We have to throw like 4 or 5 things at it in order to try to make it better, whether it's filler, whether it's laser, whether it's creams, but you can inject a little bit of Botox. It's very tricky and very sensitive into the smoker's lines and try to relax the orbicularis, again, the muscle around the mouth, from making a pucker like you would if you were grabbing a cigarette with your lips. Again, if you inject too much, then you will not be able to whistle. It may impact your speech and you'll have to wait till it wears off. So that one you want to do judiciously, and it doesn't really make a tremendous impact anyway. The last one is something called a DAO, depressor orbiculi angularis, which is you're injecting a quarter of the jaw right next to your chin. I'm pointing to it if you're watching. If you're listening, it's taking your corner of your mouth down to your chin. There is a muscle there that pulls the corner of your mouth down. And so you can inject that. It releases or relaxes that muscle. And so when you smile or talk, your corners of your mouth rotate up and make perhaps a rounder rather than depressed smile. Very tricky to do, because if you inject incorrectly there are a lot of other muscles and it can get a little bit complicated. So this one requires some skill to do. And like every single other one I told you, these are things you try and you see. The one huge positive about Botox is that everything, and I mean everything, is reversible. You love it, it reverses. You hate it, it reverses. Your eyelid droops, it reverses. So it is an incredible tool that we have. And I thought this was really interesting because we are all very familiar, as I mentioned, the people in Africa even know, about Botox and its normal uses. But these 8 or more areas of the facial anatomy are very interesting. And with the right injector and nuance injection, you might find that they are adjunctive to other cosmetic procedures. At any rate, that wraps up a quick and dirty episode of Plastic Surgery Uncensored. You know I'm going to ask you 2 things, as I do at the end of every show. Number 1, if you love this show, thank you. Do me a favor. Help us. Write something nice. When you write something nice, it makes everyone who's on this show feel awesome and inspired to keep doing the show. You know how it goes. Positive reinforcement goes very far. Secondly, if you think the show is cool and maybe helpful, you never know when someone you love, a friend, a family member, is about to go do something cosmetic and you're like, shit, I wish they had this information. So share our podcast with as many friends and family as you can, because as we get the word out, the more people are informed and the better they do. At any rate, as always, thank you so much for tuning in and listening to our show. I'm signing off as your host, Dr. Rady Rahban, on Plastic Surgery Uncensored.